Hello, my name is Stephanie Jeffrey with the Manitoba Fitness Council. Today we are going to talk about an introduction to the Parq Plus. The Parq Plus is a tool that has replaced the Parq, which had been used in the fitness industry for many, many years. The Parq Plus, and more relevantly, the 2017 version of the Parq Plus, are available at www.eparmedx.com. There is another form that's also available on the site called the eParmedx Plus, and we're going to talk about both of those today. So the Parmedx and the Parq Plus replace the Parq. There was an old Parmedx as well, and that is no longer in use. The Parq Plus was first launched in 2014. It has been re-released every year, and basically it is now an evidence-based document, which the Parq was not. So the 2017 eParmedx was developed independent of any organizational affiliation, and the researchers that had put it together were intending that it be able to be used worldwide or universally. The Parq Plus was developed a couple of years ago, and the biggest reason why was that the Parq had outlived its usefulness. So what happened was, in the industry, there were a lot of people who were using the Parq, but there were a lot of people who weren't using the Parq, and basically what happened is there was a lot of different people using a lot of different tools. So in order to make sure that we were following best practice and some evidence-based information, they decided to create this best practice screening tool that can be used by individuals, also can be used by qualified exercise and fitness professionals. So those can be either certified through their provincial associations or kinesiologists, organizations, researchers, health and allied health professionals involved in health or performance-rated physical activity or initiatives. In order to make sure that you understand how the form works and how it can be interpreted by both participants and fitness instructors or health professionals, it's important that we go through the questions just so that we can figure out what goes where and how we determine if people are going to be self-selecting as apparently healthy. So these 7 questions are super important and will have a lot of implications further on in the document depending on how they're answered. So number 1, has your doctor ever said that you have a heart condition or high blood pressure? You're going to have your participants check yes or no. Number 2, do you feel pain in your chest at rest, during your activities of daily living, or when you do physical activity? Again, have them click yes or no. Do you lose balance because of dizziness, or have you ever lost consciousness in the past 12 months? Again, yes or no, but making sure that if it's, if they were participating in a marathon and they'd really push themselves to that end, that this is not one of those reasons that you would list here as a general health issue. Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure? Please list conditions here. So this is where you would list any other condition, anything from depression, asthma, COPD, diabetes, arthritis, any of those conditions, you're going to have them list them here. Number 5, are you currently taking prescribed medications for a chronic medical condition? Again, you're going to have them list their medications. If they are, have them check yes. If they're not, have them check no. Number 6, do you currently have had in the past 12 months a bone, joint, or soft tissue problem that can be made worse by becoming more physically active? Please answer no if you've had a problem in the past, but it does not limit your current ability. So basically, if you broke your shoulder when you were a kid, it doesn't give you any issues. So obviously you have had that, but being more physically active today is not going to make that any worse. And we want to make sure that we have that dictated on here. Number 7, has your doctor ever said you should only do medically supervised physical activity? Again, a super important question, and you want them to answer yes or no. Further down on the bottom of page 1 of the Parq Plus, there are a number of points that we need to kind of consider in order to be able to take not only the information that they've answered above, but just make sure that they don't fit into any other high-risk categories. So number 1, start becoming much more physically active, start slowly and build up gradually. Follow international physical activity guidelines for your age. In Canada, we actually have the Canadian Physical Activity Guidelines. You may take part in a health and fitness appraisal. So again, if someone has not been active for a long time, that might be an important step, and some facilities actually require a health and fitness appraisal before people actually participate. Here's a new target group or higher risk group that we may not be aware of. If you were over the age of 45 and not accustomed to regular vigorous or maximal effort exercise, consult a qualified exercise professional before engaging in this intensity of exercise. So basically, you want to have a conversation with them, with your participant, before they kind of get in there and start giving it their all. You want to make sure that they take it slow. And again, that's going to come out in a directive from the report a little bit later. And if you have any further questions, contact a qualified exercise professional. So again, this is on the client's form. Now, if you answered yes to any of the questions above, you're going to move on to pages 2 and 3. But other pieces that you need to be aware of: delay becoming physically active, more active if you've been temporarily ill. So if someone has had a cold or fever and just is recovering from that, probably not a good time to start a fantastic new exercise program. If you are pregnant, so on the last Parq, you were immediately sent to the Paramedics. Same thing with the pregnancy. The eParamedics is going to be something that you're going to have your client then fill out. And they're going to ask questions throughout that form that you wouldn't be able to interpret their answers to, even if you knew the answers to them. Or finally, if their health has changed. So if they, for instance, had cancer, but now they're in remission, but that was a change from the last time they had exercised. Again, it's just flagging them to say, you don't have cancer maybe right now, but it's something that you want to make sure that they are cleared for exercise before they start in a new program. Risk factors that have been identified that increase the risk for adverse responses in a particular sudden cardiac death include. So this document, again, is just giving you some ideas of some of the things that can increase your risk of having sudden cardiac death. So that would be increased vigorous intensity exercise, being of the male sex, the absence or limited previous physical activity history, so if you've not been participating, increased age, and this is cited at the bottom here for reference. So imagine now you are at the second page. People have answered no to all of the questions on page number 1, and they are on the back page. So it is advised that you consult a qualified exercise professional with advanced university training to help you develop a safe and effective physical activity plan to meet your needs. So this is if you are have answered. So imagine now you have someone who has completed the whole page 1. They've answered no to every question. Basically, what the back part of the form is saying is that even though you answered no to all these different questions, you should still talk to someone about developing a safe and effective physical activity plan to meet your needs. They want everyone to kind of start with a low to moderate intensity level and kind of work their ways up, starting with 3 to 5 days per week, including both aerobic and muscle conditioning classes or exercises. And as they start to progress through their level of physical activity, moving up to accumulate about 150 minutes per week of moderate to vigorous intensity exercise. Some of these other pieces are from the front covers. So basically, if you answered yes to one of these questions, you should go online and do the eParamedics online, and we're going to work through that. Or if you may want to delay becoming more active, again, those things that we talked about that were on the front page of the form. So now we are at the bottom of the 4th page of the print form of the Parq Plus. And basically what this is it is a declaration from the participant basically stating that they have answered all the questions truthfully and given you the best information, and that if there are any changes to their health status or diagnosis, that they will let you know and do another Parq. Also that if it's only valid for 12 months, so if it has been more than 12 months since they have participated in your specific class or workshop, that you will have them fill out a new form. The best way to make sure we are getting all of the correct information is actually to use the paper form as little as possible and only use it in instances where a computer or is not available, or people don't have access to a computer before they come to class. If they do have access to a computer before they come to class, you'd like to ask them to visit the eparmedx.com form. This will take them right to the online version, and you'll see as we go through it how easy it is to kind of go on, get it done, and have a clear directive that is printed out and brought to the fitness leader or fitness instructor at the end of the questionnaire. When they click on the top at the Take Parq Plus online, you're going to get to the first screen, and basically right here it's going to talk about the reasons for the screening tool, a little bit about how it was developed, its uses, and more importantly, the start of the actual survey. In the online version, each question is its own page, and the reason for that is if you happen to answer yes to any one of these questions, it's going to take you to a different page to ask some qualifier questions about the question that you have just answered. Now, imagining that someone has answered no to all of the questions, it is going to take them to this back page and give them a directive. So basically what it's saying is that your answers indicate that you've been cleared to start becoming more physically active and to engage in a fitness appraisal. So there's an opportunity for them to click on a fact sheet link. It also says you are encouraged to start slowly and build up gradually towards 20 to 60 minutes per session of low to moderate intensity aerobic activities. So again, this is information that was on page 4 of the Parq Plus, the printed version, and here's just the directive that they are going to print off and bring back to you at the fitness class or facility. It's very important that if people are bringing you back in this directive that they have their name on it, it is signed by them, and it is also witnessed by someone else. So now what happens if someone answers yes to one of those questions on the Parq? So let's take question number 1. Has your doctor ever said that you have a heart condition or high blood pressure? So in this case, we are going to try out the form by trying some different answers. So let's click yes. Very quickly what happens is that the survey is over, and the reason for that is the Parq Plus is not the right survey for this participant to take, and all of those other questions that we talked about are actually included in the eParmedX. You can see the link on top of the screen, or the survey will end and once you press this complete button, it will give you the option of taking the eParmedX instead. Let's try a few scenarios. So we're going to start off with Billy. Billy is 10 years old, he is active, and his weight is about 10 pounds overweight. Now you remember at the beginning of the webinar today, we talked about the fact that this particular form is ageless. So it used to be that it was only for those ages 15 and over. Now people as young as 10, 5, that sort of thing, as long as they have parental consent to do the form. Actually, you would have their parent do it, but you would go through the list of questions. With Billy's scenario, I would guess that he would answer no to each one of these questions. Now, we don't want to assume that. We would have the parent actually fill out the form, but we're assuming that all the answers to this would be no. Just as we thought. After answering no to all the questions on the Parq, Billy has been given a clean bill to go and participate in physical activity. Again, at the bottom of the form would still be that signature portion that his parent or guardian would have to fill out to ensure that you were able to take this information and use it for your fitness purposes. Now let's try something a little bit more complicated. So we have scenario number 2. Tammy is 35 years old. She is pregnant in the 5th month. She has been walking 30 minutes per day throughout her pregnancy, and she is reporting to you that she has no health concerns. Remember when we looked at page 1 or even page 4 of the Parq Plus that there was a piece on there that said you might want to delay becoming more physically active if you are pregnant. So you're going to direct her immediately to the ParmedX. She's going to skip right over the Parq Plus because there's nothing in that would relate to her specific condition. So the number 1 question on the Parq or on the eParmedX is there a chance you might be pregnant? And she's going to answer yes. There are a lot of questions on the Parq or on the eParmedX that we cannot anticipate. We also cannot determine what the answers mean. So that's why it's so important to do the eParmedX. So question number 2, do you have a pre-existing medical condition such as high blood pressure, heart disease, abnormal heart rhythms, patterns, respiratory disease, diabetes, cancer? So this is on top of the pregnancy. Then we get into some very specific pregnancy-related questions. And this is talking about lots of times it could be things that happened in the past with previous pregnancies or something that's happened with this pregnancy. And it's going to ask things like, have you had premature labor in the past? Have you had ruptured membranes or persistent bleeding during the second or third trimester? Have you had pregnancy-induced high blood pressure? Have you had incompetent cervix? Evidence of poor growth of the fetus? And again, if you are uncertain of any of these conditions, please answer yes. If you are certain regarding the history or presence of these conditions, you're going to have them answer no. Again, you're not going to be directing them. They're going to be answering these kind of on their own. So she's answered no to both of the previous questions. Again, this is a pregnancy that has been free of issues, and a pregnancy that she's had in the past has been free of issues. So basically, we're going to go back into those pregnancy questions. So have you ever experienced any of the following conditions? And here is another list. History of miscarriage, anemia or low iron, malnutrition, or any other significant medical condition. Again, if she is unsure, you would have her answer yes. Otherwise, she would answer no. Just like in the Parq Plus, there's going to be a directive. Now, it's interesting. The reason that I actually pulled up this slide was because it says survey completed after 4 questions. But basically, because she didn't answer yes to any of the other questions that were in the actual document, it basically decided that she had a healthy pregnancy, and it has only asked her the questions that she needed to answer in order to create the directive for the fitness instructor. One thing that's fabulous about the eParmedX, among other things, is the fact that there are specific exercise guidelines. So in here, this is the pregnancy-specific exercise guidelines that would be printed by the participant, usually in their own home or in an area that they had access to a computer. And the great thing is, it's going to tell them what they need to know, and it's also going to tell you, the fitness instructor, what you need to know. So it's going to tell you about the aerobic exercise general guidelines. 3 times, so you're starting off from a minimum of 15 minutes per session, 3 times per week, approximately 30 minutes per session, 4 times per week. Many of us are going to find using rest intervals and reducing the intensity of the exercise as effective means to obtaining this goal. So again, starting slowly, working up, not wanting them to try and gain all that strength or endurance kind of in a short amount of time, and even talking about muscle strengthening guidelines. So again, kind of going through those with a participant, and they have access to them as well, will help keep everything very clear for everybody. The other thing that's fantastic about the eParmedX is not only does it talk about the exercise guidelines, it gives the participant as well as the instructor a explicit list of reasons to stop exercising. So if the participant was to experience any of these challenges, excessive shortness of breath, chest pain, painful uterine contractions, vaginal bleeding, any gush of fluid, or dizziness or faintness, then you're going to have them stop exercising immediately. And again, because it's clear to both the participant and to the fitness instructor, there's not as much room for misinterpretation. Let's work through a third scenario. So the scenario is Bob. He's 47 years old. He has been very inactive. He's interested in losing 30 pounds, and he has no health concerns that we know of. So because Bob had no health conditions, he's going to get the exact same directive printout as Billy. So basically it says that he's cleared for physical activity because there were no red flags, except for the one that I've highlighted here with the circle. So it says if you were over the age of 45 and not accustomed to regular to vigorous maximal effort exercise, you should consult with a qualified exercise professional before engaging in this intensity of exercise. So it's, aimed at those guys who are looking to come in, looking to get back in shape, or kind of work really hard very quickly, and just maybe giving them a little extra flag that if you were in this age group, you should talk to someone before you just start going as hard as you can, as fast as you can in a gym setting. One last scenario. Let's meet Sue. Sue is 55 years old. She has had a previous cardiac incident. She has just been recently diagnosed with diabetes, and she has been hospitalized in the past 6 months for heart issues. So Sue is not going to be able to complete the Parq Plus because she'll be moved to the eParamedX. And even when she gets into the eParamedX, the first question, remember we talked about, are you pregnant? Obviously the answer to that is no. We've already checked off in the second question that she has had heart troubles in the past. Question number 3 is, have you ever been diagnosed with more than one chronic medical condition? You would answer yes, for example, if you were living with heart disease and diabetes. So it's funny, the examples are right in this question. Or previously survived breast cancer, or now have heart disease. So basically, again, if they have 2 or more issues or chronic conditions, they're going to answer yes to this question. And basically what happens is that the survey is then over. Because they have a number of risk factors, it is going to give you a directive right after this. So it says, thank you for completing the survey. Based on our findings, we have provided specific recommendations for you that can be found, and let's go through those. So here's a shot of Sue's specific recommendations. So as a result of your medical condition, we recommend that you seek further information before becoming much more physically active or engaging in a fitness appraisal. It also goes down, essentially it's saying that, at this point she's not cleared for exercise. She needs to go and talk to a kinesiologist, her doctor, someone else in the medical field that can provide some guidance to her and some clearance. And so basically the next part is, once you receive clearance for unrestricted physical activity, it may be advisable to exercise under the direct supervision of a qualified exercise professional. So maybe not, getting on her treadmill in her basement if she is not sure, hasn't been given an actual prescription for exercise. So here's where we're going to wrap it up for you so that you can see what it is that you have to keep and what you have to do if people answer yes or no on the different pieces of paper or the online version. So with the paper version, if they answered no to all the questions on the front page, all you have to do is have page 1 and page 4 signed. So what we tend to do is actually have a stack of them that are just page 1 and page 4 back to back. They answer no to all the questions on the front. They just go over to the back page. If they answer yes to one of those questions, then I would give them the full Parq Plus printed version, and then we're going to go through. And if they answer yes on the paper version with the yes response on page 1, no responses on page 2 and 3, they would sign page 4. This basically means that their condition has been flagged, but they are cleared for exercise because they do have a managed chronic disease. If you go into the paper version and they say yes on page 1, yes on page 2 or 3, you would send them to the eParamedX, and then you would ask them to bring that directive back to you. That directive, like we said before, or like we saw before, with someone like Sue, the directive is that she's not ready. So that directive will interpret the information for you. We can't interpret the information that's on the Parq Plus or on the eParamedX to say, nah, no big deal. She can exercise anyway. So that's really important to understand what our role is there. With the online version, if we have no responses, you're going to have that computer directive printout like we had with Billy or Bob. If you were doing the online version and they have yes responses, they are going to have to go into the eParamedX and print out that directive. And again, it's going to come to the fitness leader and show exactly what they have been cleared for exercise for. So as we have seen today, the most current Parq Plus should be your screening tool of choice. The information is evidence-based. It has been researched. And these are not just questions that they think are indicators for people who would be at risk during exercise, but they are indicators that they know are for people at risk when participating in exercise. When possible, have participants fill it out online and bring that directive to you at the fitness studio, class, workshop, facility. You can see how the interpretation part is super challenging. So if someone says that they have diabetes, how do you know unless they fill out the whole paperwork and have it online and bring the directive to you what exactly they're cleared for, or if they are in fact cleared. When in doubt, refer to a higher qualified fitness instructor or health care provider. This is super important. Again, we need to understand what our scope of practice is. And if it is someone that has a high level of risk factors, maybe this is not someone who can come to your class without having some conversations or prescription-based information from a higher level fitness instructor. Thank you so much for joining us. If you have any further questions about the eParmedX, you can send them to us. You can also connect with the eParmedX.com. They have a contact us button at the top of their link. And in order to contact us, you can use our email address that's here on the screen, info@manitobafitnesscouncil.ca. In order to obtain your CEC credit, 1 credit, for watching this webinar, watch the webinar, then take the Parq as yourself or someone that you know. So you don't have to tell us who it is. You can just kind of fool around with the form a little bit, take the eParmedX, take the Parq Plus, whichever one you'd like. Then take the Parq Plus or the eParmedX as someone like Clyde. Clyde is 75 years old. He's had a hip replacement a year ago and has been cleared for exercise by his physician. So you're going to have to make some assumptions in this case, which is not something you would do when you were working with someone who is actually named Clive and is 75 years old and has had a hip replacement. You want him to make his own kind of interpretations of the questions and answer them as he would. But if you are just going to do this just for the experience so that you understand how the process kind of works, and when you're done sending those directives into the Manitoba Fitness Council at info@manitobafitnesscouncil.ca. And thank you so much for watching.